Welcome to our YouTube video, where we will be discussing the important updates to the government's Drugs, Poisons, and Controlled Substances Amendment Bill 2023 that will make the medically supervised injecting room at North Richmond permanent. This video will cover the recommendations that the Victorian Greens are seeking to introduce that they hope will make it easier to open up additional safe injecting rooms and allow greater access to them for individuals in the most vulnerable and marginalized parts of our population. Public health researcher John Ryan conducted an independent review of the North Richmond facility, and based on his findings, the Greens are hoping to make a few important adjustments to the bill. The Greens' Upper House MP Abe Puglielli says that the wording of the bill should be changed in order to allow for more than one medically supervised injecting room to be licensed at the same time. This, said Puglielli, would help in case the government decides to delay or even back away from the plans for another facility to be established in Melbourne CBD. A second recommendation the Greens are seeking to introduce is the change to the eligibility criteria of the North Richmond Safe Injecting Room, which currently locks out pregnant women, people under 18, and those with court orders. People who need assistance injecting drugs would also be granted access to the facility if this change goes through. At present, individuals in these vulnerable and marginalized groups are denied access to the facility, which is a great disservice, according to the Victorian Alcohol and Drug Association's executive officer, Sam Biondo, given that the facility has the potential to provide access to other forms of support such as housing and mental health services. The Greens are pushing hard for the passage of these amendments so that individuals who currently lack access to essential medical care can receive the help that they need. It is also important to look at how individuals connect with the healthcare system after leaving the criminal justice system, as many people are particularly at risk of overdose after release. If we can prevent overdoses and give people access to the necessary medical care that they may need, the entire community stands to benefit. We look forward to seeing how this bill develops, and will be sure to update you as new information is released.